Okay, Viren Shetty, Executive Director and Group CEO with Narayana Health joins us. Let's take our conversation forward with him, how things have transpired for Narayana Healthcare as a company for the quarter gone by. Viren, good morning. Thank you for joining us. Now, the quarter gone by, in a sense, was a differentiated quarter. We were coming off the second wave compulsions, and then there were some restrictions which were at play. But despite that, you've reported good, solid record profitability. So what is the secret sauce here?
Well, nothing about this time of our lives is normal. And you're absolutely right. Coming off a COVID quarter, this would be the first normal quarter we've had in a very long time. And so it's basically a lot of patients coming back to get the surgeries that they've been postponing. Anything that brings about uncertainty, travel restrictions, COVID-related lockdowns, it impacts people's intention to choose coming for elective surgery. So because this was the first normal quarter we've had in a long time, people are coming to get the procedures that they've done. And that's essentially all that can explain the performance.
So if you now work with an assumption, and we all are keeping our fingers crossed that we don't have to deal with another COVID wave, what would be the balance? COVID revenue goes down and the normal business comes back. So where would be the striking balance for you?
Well, the balance is one in which there's no COVID, obviously. I think even in the healthcare sector, we among with everyone else in the world, we're tired and sick of this. In the last quarter, we didn't see more than 1 to 2% of the total admissions and revenues accounted for by COVID in this quarter. So hopefully that goes down to a negligible number. And it goes back to the things that hospitals like ours were built to do, which was to do surgeries, procedures, patients coming in for cancer treatment and so on. So the balance basically is a happy medium between that. But there are a lot of changes in the way people are interacting with the health systems now. And so what that means is we have to do a lot more to get people more convinced about the procedures that they do, being able to reach out to them through a lot of online means, and being able to have them speak to doctors several times before they physically come and visit the hospital. So that would maybe require a lot more investments in outpatient work, in telemedicine, and those sorts of activities, which hospitals like ours and many others are doing. But in terms of the specialty mix of COVID versus non-COVID, an ideal obviously would be one in which there's no COVID or very negligible COVID business.
What are the permanent changes which you adopted because COVID either forced you to do them, or those were innovations which were overlooked, but they have been part of your business operations now? What I'm trying to understand is that what are the new cost levers which were ignored earlier, but they are at play now, and what are the cost, inflation factors which have kicked in, which are compulsive in nature?
So COVID accelerated a lot of the activities that we were engaged with, and it caused us to invest a lot more in it. Now, prior to COVID, the two things we were focused a lot on, one is the patient experience, the other is the digital. And both are actually quite closely linked to one another. On the digital side, while we may have been spending a reasonable amount, let's say 20, 30 crores per year on all the activities, we've essentially doubled that. Investments in the core technology, investments in our call center, investments in ERP, CRM, basically anything that can allow us to process patients with a lot more efficiency, be able to reach out to them through multiple media. Those are things that have permanently changed, and we'll continue to grow and expand on that. Similarly, investments in the patient experience, because the typical image of a hospital of ours, which is one of crowded lobbies, very full OPD, a lot of waiting for hours to see the doctor, waiting for hours to get a slot in MRI. All of that has to go away. One, because during COVID, you cannot have crowding in a stagnant area because that leads to cross-infection and so on. And the other is it's just not convenient for patients anymore to come to a hospital and expect to wait 6 to 8 hours just to get a simple set of procedures done. So we've invested a lot in getting people onto online appointments, invested a lot in getting all our scheduling done from the doctors, invested a lot in segregating all the different areas for billing, for pharmacy, for pickups. And these are the kinds of things that we were doing, but obviously COVID accelerated that a lot more, and we'll continue to do. And that is a permanent change, I would say. Your experience with the hospital has permanently changed in terms of how you as a patient get to feel when you come and visit us.
So yes, contactless platform play when it comes to healthcare is something we saw during COVID, and the sense I'm getting from you is that you're only going to accelerate that and build upon that. What I would also love to get a sense from you is, and something that COVID taught us, we don't have enough doctors, we need more healthcare workers, and we don't have enough hospital beds. Can I ask you from that perspective what your expansion plans can be? You have, for example, announced a new one in Gurugram.
We've announced an expansion to the existing hospital in Gurugram. Yes, you're right. Absolutely. There were not enough doctors, nurses, or hospital beds before the pandemic. It became painfully obvious during the pandemic how short all of us are, and will continue to be the case going forward. Now, the investments we are doing is on increasing the scope of our services. So we want to convert all our hospitals into oncology units. So we'll be expanding by adding radiation therapy and adding beds for treating onco patients. We'll be adding more beds. These are primarily dedicated ICUs, so that should anything, maybe COVID or maybe something else like COVID happen again, all our beds should be able to convert to ICU beds and be able to give oxygen and ventilation support and continuous monitoring for the patients. We haven't looked at any new greenfield investments because at this time we believe that there's a lot more scope within our network to be able to expand, and there are a lot of inefficiencies in the way we're currently operating where we can easily be able to achieve greater occupancy levels and greater throughput with the existing infrastructure. So a lot of what we're doing is incremental and brownfield in the sense of adding, let's say, 50 beds to an existing 200-bed hospital.
Just coming back from the market's perspective, and the healthcare perspective, the sense I got from this interview and what you were saying is, are people now coming back for elective procedures? Are they feeling more comfortable? And therefore, what is also going to mean for medical tourism? That had become a big growth driver too, as far as hospitals go.
Yeah. Unfortunately, medical tourism still has not recovered. We used to get a large number of patients from Bangladesh, Afghanistan, the Middle East, Iraq, Africa. Because of the inconvenience for the flights, because of the COVID-related restrictions, people's fear around traveling, it's come down from what used to be 11 to 12% of our revenue to not even 0.5% to 1%. That will continue to be challenged until everyone just generally gets more comfort around travel and as flights reopen. So that may not be something that we're looking at. But in terms of the average patient in India, yes, I definitely think the same comfort that they displayed in going out and bursting Diwali crackers and going for weddings, they have displayed in terms of coming to the hospital and getting these long postponed elective procedures done. Because with a lot of things, what people realize, you can push it for 6 months, 8 months, maybe even a year. But anything beyond that, it then starts to impact you. And then what turns into a simple procedure becomes something a lot more complicated, a lot more expensive, or in certain cases, like if you have cancer or something, almost inoperable. So there is only a limit beyond which you can postpone elective cases, and then we're almost at that threshold now. And so people are coming and they're a lot more comfortable. And hospitals have done a lot more to make patients feel comfortable about the environment they're going to be operated in.
Would you have any fundraising plans? I also asked this because now most of the hospital chains are in expansion mode. We've also heard of fundraise drives. Those in the private space are also looking to IPO.
Yeah. Not anything planned as of now. Something we had noticed prior to the pandemic, and we'll probably have to go back to our numbers and look, is that the overall economics of this business are still quite stressed. While quarter on quarter and here and there, you'll see us making reasonable amount of profit, it still is not enough to justify the return on capital that this business requires and the amount of investment that's needed now. So for example, I would have never thought so much about what the air conditioning system of a hospital has to look like. But ever since COVID happened and the ASHRAE, which is the standards that decides what air conditioning standards are, they've come up with a whole new setup which involves putting HEPA filters in every single room. HEPA filters is my fine microfilter that can block the COVID particles. And that's the only thing that works. Now, these sorts of things really drive up the cost of construction, which was, as it is, very high to begin with, and the sheer amount of compliance you have to put in. So hospitals are incredibly expensive things to put up. And even if we were to raise funding, and there's a lot of interest for people to fund expansion, we don't believe it's justifiable by the long-term returns from this, the way we're currently set up. Now, a lot of the work that we're doing in the incremental expansion and investments in our efficiencies are all about making it so that the hospital become a lot more effective, that you don't need to add as many beds as you used to in the past, that you don't need to build as many operating theaters or fill it with so much new equipment. Because at the current investments, you're looking at 1.5 to 2 crores per bed if you're to build a new building from scratch, not including land. That break-even point is really hard and to achieve. And the other thing is, it takes 8-10 years to get to a decent IRR on those projects. Whereas for the hospital that we have already, it's a lot easier for us to operationalize that. But it will change, I think, in the future as rates start to get more normalized in terms of how much the government reimburses for procedures, as health insurance starts becoming more common and more people stop paying out of pocket and get more insured. You will get to a happy medium, at which point it will make a lot more sense to add a huge amount of capacity all at once. But otherwise, at the current rate that things are going, what ends up happening too often in our industry is that too many hospitals come all at the same time. There's not enough doctors to come in. There's a war for talent. Doctors get overpaid. Then there are too many beds, and it's in big cities I'm talking about, not in the small towns, only in big cities. Too many beds, not enough patients to go there. Hospitals start lowering their prices, and it just depresses the sector for everybody. So from this particular phase, we may wait it out for a year or two, see how things go, and then take a call.
Right. Okay, Viren, good speaking with you. Thank you so much for highlighting how your quarterly performance was and what things are looking like going into the future. Let me also